తలనొప్పి, నరాల బలహీనత, మూర్ఛ వ్యాధి, పక్షవాతం, బ్రెయిన్ స్ట్రోక్, బ్రెయిన్ ట్యూమర్స్, మెడ, వెన్నెముక సమస్యలు, పక్షవాత సమస్యలకు పరిపూర్ణ వైద్యం. మన దేశంలో ఎక్కడా లేని ఆపరేషన్ థియేటర్, అమెరికాలో జరిగే వైద్యం ఇప్పుడు గుంటూరులో. చిన్న కోత ఆపరేషన్ల ద్వారా కేవలం 2 రోజుల్లోనే డిశ్చార్జ్. డాక్టర్ రావ్స్ న్యూరో హాస్పిటల్, గుంటూరు. సంప్రదించండి 9010056444, 9010057444.
What is a stroke, and what are the different types of stroke? A stroke is a medical emergency when the blood supply to the brain is interrupted, causing brain cells to die. There are 3 main types of stroke: ischemic stroke, hemorrhagic stroke, and transient ischemic attack, TIA. What are the symptoms of stroke, and how can one recognize them? The symptoms of stroke depend on the type and location of the stroke, but they usually come on suddenly and affect one side of the body. Some common symptoms are weakness or numbness in the face, arm, or leg, difficulty speaking or understanding, confusion or trouble with memory, vision problems, dizziness or loss of balance, severe headache, or nausea and vomiting. A simple way to remember the signs of stroke is to use the acronym FAST. Face drooping, arm weakness, speech difficulty, time to call emergency. What are stroke's causes and risk factors, and how can one prevent them? The leading cause of stroke is atherosclerosis, the buildup of fatty deposits in the blood vessels that supply the brain. This can lead to blockages, ischemic stroke, or ruptures, hemorrhagic stroke, of the blood vessels. Some risk factors for stroke are high blood pressure, high cholesterol, diabetes, smoking, obesity, physical inactivity, heart disease, family history, age, gender, race, and previous stroke or TIA. To prevent stroke, one should adopt a healthy lifestyle, eating a balanced diet, exercising regularly, quitting smoking, managing stress, controlling blood pressure and cholesterol levels, and taking prescribed medications. How is a stroke diagnosed and treated? Stroke is diagnosed by a physical examination and various tests that can show the type and location of the stroke. Some of these tests are blood tests, electrocardiogram, ECG, computed tomography, CORT, scans, magnetic resonance imaging, MRI, carotid ultrasound, cerebral angiogram, or echocardiogram. 4. Stroke treatment depends on the type and severity of the stroke, but it usually involves restoring blood flow to the brain and preventing further damage. Some of the treatments are clot-busting drugs for ischemic stroke, surgery for hemorrhagic stroke or severe carotid artery narrowing, endovascular procedures such as stent placement or clot removal, or rehabilitation to improve function and quality of life. What are the complications of stroke, and how can they be managed? Stroke can cause various complications, such as brain swelling, bleeding, infection, seizures, depression, cognitive impairment, communication problems, physical disability, pain, and blood clots. Different methods can manage these complications, such as medication, surgery, rehabilitation, counseling, and preventive measures. How long does it take to recover from a stroke, and what factors affect the recovery process? The recovery time from a stroke varies depending on the type and severity of the stroke, the extent of brain damage, the age and health of the patient, and the quality of care and rehabilitation. Some people may recover within weeks or months, while others may take years or never fully recover. The recovery process can be affected by factors such as motivation, support, coping skills, and treatment adherence. What are the best exercises for stroke recovery, and how often should they be done? The best exercises for stroke recovery target the affected body areas and improve strength, coordination, balance, and mobility. Some examples are stretching, range of motion exercises, aerobic exercises, resistance training, functional tasks, and recreational activities. The frequency and intensity of exercises depend on the individual's condition and goals, but generally, they should be done at least 3 times a week for 20 to 60 minutes per session. What are some common myths and misconceptions about stroke, and why are they wrong? Some common myths and misconceptions about stroke are: stroke only affects older people. The stroke is not preventable. Stroke symptoms always go away quickly. Stroke recovery stops after 6 months. Stroke survivors cannot lead an everyday life, and stroke is not a severe condition. These myths are wrong because stroke can affect anyone at any age. Most strokes can be prevented by controlling risk factors. Stroke symptoms can last for hours or days or become permanent. Stroke recovery can continue for years with proper treatment and rehabilitation. Stroke survivors can achieve a high quality of life with appropriate support and adaptation. And stroke is a leading cause of death and disability worldwide. What are the long-term effects of stroke, and how can they be managed? The long-term effects of stroke depend on the type and severity of the stroke, the area of the brain affected, and the extent of recovery. Some possible effects are physical disability, cognitive impairment, communication problems, emotional changes, personality changes, behavioral changes, and social isolation. These effects can be managed by various methods, such as medication, rehabilitation, counseling, support groups, and adaptive devices. How can I cope with the emotional and psychological impact of a stroke? A stroke can be a traumatic and stressful experience affecting your mood, self-esteem, and outlook. You may experience various emotions, such as shock, denial, anger, sadness, fear, anxiety, guilt, or depression. These emotions are normal and understandable but can interfere with recovery and well-being. What is a comprehensive stroke center? A comprehensive stroke center is a type of hospital that meets the highest standards of care for stroke patients. It can treat the most complex and severe stroke cases, such as large ischemic strokes, intracerebral hemorrhage, and subarachnoid hemorrhage. A comprehensive stroke center has the following features: availability of advanced imaging techniques, such as angiogram, perfusion imaging, CT. Availability of personnel trained in vascular neurology, neurosurgery, and endovascular procedures. 24/7 availability of personnel, imaging, operating room, and endovascular facilities. ICU, neuroscience ICU facilities and capabilities. Experience and expertise in treating stroke patients. Use of data to assess and improve the quality of care for stroke patients. A comprehensive stroke center can offer more specialized and advanced treatments for stroke patients, such as IVTPA, mechanical thrombectomy, and neurocritical care. What is the best comprehensive stroke center in Guntur? Dr. Rao's Hospital is one of the best neurology hospitals in Guntur, Andhra Pradesh, that offers stroke and cerebrovascular treatment. They have a team of experienced neurosurgeons and interventional neurospecialists, led by Dr. Mohana Rao Patabindla, considered the best neurosurgeon in Andhra Pradesh. They provide advanced treatments for stroke, such as IVTPA, mechanical thrombectomy, and neurocritical care. They also have a high success rate and patient satisfaction. Dr. Rao's Hospital might be a good option if you are looking for a comprehensive stroke center in Guntur.